Me. Okay, I need to now inform you that we're being recorded, and I was going to mention that later. Please do let us know if you have any concern about the recording. We will do our best to address. I mean, either that's by removing your name in our recording later, or just making sure that your confidentiality is protected later. So, but do let us know in the chat box if that's any concern. So thanks again for joining us, everyone, for our last C19RM Funding Request Development Focused webinar session, which we aim to look at lessons from civil society and communities in Asia Pacific from the recent C19RM Funding Request Development process. So briefly, and just for those of you not as familiar with the COVID-19 response mechanism, which it's called C19RM. Briefly, in April 2020, the Global Fund established the COVID-19 response mechanism, which aimed to support countries to respond to COVID-19 in mitigating its impact on HIV, TB, and malaria programs, and to strengthen health and community system. A second phase of the C19RM was launched this year, given the continuation of the COVID-19 pandemic that's really still happening and going on in many parts of the world. The fund aims to expand support to interventions to include additional categories apart from COVID-19 risk mitigation. So these additional areas of intervention included COVID-19 control and containment interventions, COVID-19 related risk mitigation measures for programs to fight HIV, TB, and malaria. And I think very importantly, it also includes helping community systems strengthening, which includes community-led monitoring, community-led advocacy and research, social mobilization, building community linkages, coordination, institutional capacity, and other and gender-related and human rights-related barriers to services that's linked to the impact of COVID-19. So I think what's really important to highlight with this second phase of the C19RM is that the Global Fund has specifically highlighted the importance of effective and meaningful community and civil society engagement in this second cycle. And so, and part of that emphasis is really drawing from lessons during the first cycle of the C19RM. And so beginning April of this year, APCASO has worked really closely in collaboration and also with the support of the CRG department in Global Fund and also other CRG, other Global Fund colleagues to work closely with civil society and community-led organizations in 10 countries in our region. These are Bhutan, Cambodia, India, Indonesia, Laos, Malaysia, Nepal, Pakistan, Papua New Guinea, and Viet Nam to really provide a more in-depth and concrete support to civil society and community groups in the country as the country move into the funding request development for their respective C19RM. So part of what we're hoping to do really is to bring together partners and also other colleagues from around the region, and also we have colleagues joining us from the Global Fund to debrief their experience and also our experience in providing TA as well, and to share lessons from their engagement, from partners' engagement at a country level around the C19RM development process, and to really identify also challenges and opportunities, that communities and civil societies face in their engagement. So let's move on to, sorry, there are a couple of things I should take care of before we move on. So we have about 32 participants with us today. So it might not be sensible for us to have a round of introduction, as much as we would love to hear and see everyone's face. So may I just request that everybody to please take this opportunity to introduce yourself in the chat box, your name, the organization or the network that you work with, and also where you're based, which country from the region or from the world that you are working out from. Again, we'll be recording the session, so do let us know if that it's a concern for you. And without further ado, let me open up the session by just kind of briefly share with you the overview for today's program before I move into an opening remark from R.D. Marte, who is the Executive Director of APCASO. So first slide, please. I'm not sure who has the control of the slides right now. Is that you, Rata? Can I have the first slide? Thank you. So you will see on the slide right now, we will be, for the next 2 hours, that we'll be hearing from colleagues from the Global Fund, and then we'll also be hearing from various colleagues who were part of the APCASO C19RM project recently. We have built-in time for question and answering after each session. However, please do feel free to utilize the chat function throughout the session and presentation if you have any question that you would like to ask to our speakers. Just in case that we are not able to get to your questions during each session, I would kindly request the speakers to please also check in the chat box and to please help respond.
Jen, are you there? We lost you. Is it only me?
We lost Jen.
Okay. While we're waiting for Jen, just to take off from where she left, just again, please make use of the chat box to introduce ourselves, as well as to park questions which you would try to address. All of that have been covered by Jen. Jeff, do we just proceed then? I could go ahead and do like a quick remark.
Yes, please. Yes.
Okay. Yeah, and then we'll have Jen back over again. I'm just very conscious of time, and it's important for us to devote the time that we've allotted squarely for our country presentations, as well as for the presentation from the Global Fund. So good afternoon from Bangkok, everybody. My name is R.D. Marte, and I'm the Executive Director of APCASO. I'm also part of the founding members as well as the steering committee of the Activist Coalition on TB Asia Pacific. We're really very happy and honored to be again hosting this call. As Jen has mentioned earlier, it only began, at least for APCASO and our country partners, mobilizing on C19RM, started in April. Now it's June, so it's about 3 months, but it's been quite a whirlwind of regional to country coordination, consultations, documentation, communication, and advocacy work. In the heart of all those activities and in the heart of all those engagements and passion, what was really fueling our action is this common desire from the side of APCASO and our country partners, a common agenda to really see C19RM address real needs and priorities of key vulnerable and marginalized communities in the context of the 3 diseases and beyond, the communities that are vulnerable also to COVID-19, particularly through ensuring prioritization of community rights and gender responses. These are the things that usually the favor are skewed against communities, in these kinds of decision making in the country if we don't mobilize and if we don't coordinate. And if we don't advocate, there's a lot of danger and pitfalls in terms of, our issues being overseen and neglected. So indeed, this webinar, we are wishing to take as an opportunity to take stock of lessons and challenges for community engagement and in C19RM. That is definitely very important, but I guess my challenge to all of us is while we do focus on C19RM lessons and challenges, at a certain point, we should also reflect on and interrogate and not forget the broader picture of community engagement issues in broader global fund responses and in broader country health responses. Because indeed, while C19 has caused serious disruptions in the lives of vulnerable communities, it has exacerbated vulnerabilities, it has highlighted inequities in health and rights enjoyment. C19, we hope that it would go away. If it goes away, if ever it goes away, there would always be new pandemics. COVID-19, we hope will go away. If it stays, then we hope we're able to grapple with it in a better manner. But what we're sure of is that who would stay are the communities on the ground. So the lessons that we would take from C19RM engagement on strengthening community systems, lessons on institutionalizing community engagement in decision-making and responses rollout would also be valuable lessons in terms of if we have to do something similar in the future, confront new pandemics, as well as ongoing health responses, we're able to be better informed by lessons of how to do it with the experience from C19RM. I would not want to take much further of our webinar time, but I would be remiss if I, at this point, because it's been really a lot of work, a lot of dedicated and committed work to be able to pull a lot of the things together in the 10 countries where we provided support. I would be remiss if I don't get to acknowledge, I think I would focus on 3 key groups. One is really APCASO and country partners. Sincere thanks to the Global Fund, particularly the CRG department, for the resources that they've provided, very mindfully making sure that there are resources for engagement coordination from the very beginning. Aside from the financial resources, also the information that was forthcoming, the transparency, the allyship, the listening and the caring. We felt very listened to, and we felt, that they really cared what happens in terms of community engagement, and there was always direct room for communication and even facilitating communication with fund portfolio managers and other groups on that side. And I think that's a model that we really commend and that needs to keep on happening if we want to do things better and also appropriately. Of course, the APCASO team, both the admin and the program team, it hasn't been too simple trying to coordinate, trying to put in the contracts in place to support the work of our partners in the 10 countries. The team has really risen to the challenge too within that short, very quick time period, making sure that it's able to reach out to the country partners in a way which we hope was really facilitative. That didn't add the burden to the countries, but in a way that's really respectful, as well as facilitative and helpful. And last but not the least, really to the country partners who did the work on the ground, who again and again and again rise to the challenge of mobilizing communities on the ground, leading advocacies and country mobilizations, even amidst their own difficulties as they grapple at both the community and personal levels themselves with the onslaught of COVID-19 and even losses from COVID-19. And I think, I mean, it's not the last time that we would do this with them. We keep coming back to them because they're the reliable partners who could change things and move things on the ground. We've done this with them a number of times, and in anything that would happen in the future, we would see the partnership continued. So hats off and thanks to you. And we look forward to hear about your experiences and learn from them. And thanks so much, everybody. Looking forward to a really good discussion and webinar. Over, back to you, Jen. Thanks, everybody.
Great, thanks, RD, and apologies for earlier unexpected Zoom shutdown from my end. But without further ado, let me introduce our first speaker, and that's Gils Cesare from the CRG department, who will be sharing with us a little bit about what's next for C19RM. And I think we flipped the order a little bit in terms of the flow today, just because we think it makes a little bit of sense for Gil to help us set up the context a little bit about, you know, now that we have pushed forward with community priorities in the C19RM, what's up next, right? So let me turn the floor over to Gil and take us away. Over to you. Gil.
Thank you, Ardi and Jennifer. Hi, everyone. So my name is Gilles Cesari, and I work at the Global Fund in the Community Rights and Gender Department. I will co-present with our colleague Nicole Delaney, who is a Senior Fund Portfolio Manager in the Southeast Asia team. I hope she'll be able to join. I think she had some technical issues. I was talking to her before. And I want to thank really Gemma, who helped us to prepare this analysis of where we are in C19RM and this slide deck. So thank you very much, Gemma. So next slide, please. Just quickly, the outline. So we've discussed the status of where we are with C19RM funding requests, some lessons learned globally and in Asia Pacific. They are very preliminary lessons learned, as you will see, and also how we can be engaged after. So next slide, please. So we'll start with the status. Next slide. So as you know, we are expecting 123 full C19RM funding requests globally for approximately $3.9 billion US. You can see on the left side the projected full funding request submission window. You remember we had 4 windows in 14th May, end of May, mid-June, and end of June. As you can see, the peak was expected in the window 3, 15th of June, so 10 days ago. However, you will see that we have received many countries which registered to this window 3 have actually already slipped to window 4. And there is a news that is quite recent, was shared with the CCM a few days ago, is that there will be a window 5 on the 15th of July. Next slide, please. For Asia Pacific, as you can see, but you will have the time to go through the list later, we are expecting 25 applications from Asia Pacific, and 10 have submitted a full funding request so far. In red, there are the countries in your region which were planned to submit in window 3, but in fact have not submitted on the 14th of May, 15th of June, sorry, window. Therefore, we don't know if they are going to submit now or if they will be pushed to window 4 or even window 5. So this is important for you to look at because it means you can still remain engaged in supporting the writing of this funding request. And of course, you can also look the countries in your region which are registered for the window 4. Window 5 is not yet appearing here because so far we have not received submission CCMs registered for window 5. Next slide, please. So preliminary lessons learned from C19RM funding requests globally and in Asia Pacific. Next slide, please. In terms of fast track, as expected, we've seen limited evidence of community engagement in this fast track funding request. Of course, the full CCM sign-off though was still mandatory. On the content of the fast funding request that we have assessed so far and awarded, of course, the focus is on oxygen needs and also PPE and tests. And as you know, what we've done is to look at the equitable access of this PPE, especially, and the COVID-19 tools in general. So for example, the inclusion of community and peer workers, in the PPE quantification. So that's for the fast track. In terms of the full funding request, and again, this is really preliminary because we have seen and reviewed only a very, very small number of full funding requests so far. We've seen the engagement varies really from country to country, but globally we can see we've seen improved overall in comparison to last year. So we've seen, for example, a number of good examples of very comprehensive, and inclusive engagement. But in some contexts, we can see still that the engagement, especially until the finalization and budgeting stage, as still being an issue. What has changed though compared to last year is that, as you remember, one of the mandatory annexes for full funding requests is the priorities identified by civil society and community. And these are being submitted, which is really useful and helpful because we can then compare, what were the needs expressed and what has been included in the funding request. And it really helped for the review and the decision by the investment committee meeting. On the content, similarly, we've seen some improvement. We see more requests and interventions in terms of GBV, community-led monitoring, which we didn't see last year, peer outreach adaptations, and also risk communication and community engagement. But again, it's really early to assess because we had a very, very small number of funding requests so far. So it's difficult to assess the scale of these investments, and we will conduct this analysis later in September or October to compare with last year's results. But we see some challenges persisting, in balancing what is pure COVID-19 with the HIV/TB and malaria mitigations and the community and health systems funding part. This we are already witnessing. Next slide, please. So in Asia Pacific, we've chosen Philippines and Mongolia, which have been through the investment committee already. And so this applies to both countries. We've seen really efforts to really engage community and civil society in working groups for each of the disease, and also efforts to engage communities most impacted by COVID-19 in the process. We've seen also in the two countries that the request really outline well what were the needs expressed by each civil society and community, and then how it's responding, how the request is responding to these challenges and needs in the proposed activities. We have also seen in these two investments in community-led monitoring, GBV, care support, and also referral into a broader range of relevant activities. So this is really encouraging. And we also see that this funding request for Philippines and Mongolia have prioritized really community-based and community-led approaches in key interventions like HIV, TB, and COVID-19. But again, the big question here is that it's really early to draw any conclusions on trends because we have this very limited number of funding requests so far. Next slide, please. This I will not go through. It's just for you to read later. It's just some lessons learned on the fast track Senegal funding request in West Africa, because it was really good to see that even for fast track in this country, the government, the CCM, the partners, all together, the civil society have worked well even for fast track, but you can read later. So next slide, please. Yes, so next slide, please, on what's next. So this is our last slide. Nicole, do you want to jump in?
Sure, thank you very much. Hi, everybody. It's a pleasure to be with you in your webinar. I think the most critical period for community-based organizations and civil society is at the time when you are developing the input for the funding request. Because as Gilles has just pointed out, this is what the Global Fund then reviews to look whether or not to finance. And at a strategic level, what we are looking for community organizations is twofold. One is the PPE needed to make sure that the activities can continue unabated at scale for the next months ahead. And this is where we're looking at PPE quantification for 3 months, 6 months, 9 months, 12 months down the line. And the other critical area is to see whether any differences in implementation arrangements are needed. For example, increased outreach, increased number of staff that are employed to make sure that, especially where there are lockdowns and limitations in movements, that the activities under the 3 national programs can continue, in addition to the other items that Jill has covered in the presentation. And so it's critical that that gets put in. And if it doesn't, if it's not included in the funding request in its entirety, then the question becomes what options are there after the funding request is submitted to continue with the advocacy that these items are needed. So as you can see on this slide, it's really important that you're able to get a copy of the notification letter. This is a letter that sets out the decision of the investment committee, so the Global Fund's decision on the funding request for the COVID-19 request, and it'll outline any conditions that are connected to financing. The process then to getting to a grant revision is fairly quick. And the next step that you'll see if you're on the CCM is that the CCM chair will be asked to sign the grant revision document. So it's just the same as when we sign grant agreements. And so again, if you're a CCM member, then make sure that you know at what stage the grant revision is actually being executed. In the meantime, though, because the notification letter has been issued, it means that the procurement can start for example, the PPE. But it's really important that you remain engaged on those CCMs, but also directly with the country teams where you have communication channels, because what we are interested in and what we see in the investment committee decisions is a very robust analysis of whether or not community needs have been addressed in the request that we received. And if not, then we're supposed to be prioritising this for any savings that may be realised as implementation starts and reinvestments are possible. We're not there at that stage yet, though, because we've only signed the first grant revisions for the fast track several weeks ago. But it's the same as with grant implementation. Has the full request been defined? Has it been included in the funding request? If not, continued advocacy in your various channels to make sure that over time these do get realised. But again, recognising the context overall, and that is with C19, it's very simple, but also very stark. That what we also are trying to do with the funding is maximise the reach for life-saving interventions that are needed in the hospitals. And this is here about oxygen concentrators, the ventilators, and the cylinders. And that's where we've been pressured or pushed into very quick decision-making for critical commodities, especially with fast-track responses. But we look forward to, we've seen very robust processes. I can speak for Nepal because that's the country that I'm managing. There's been very strong community engagement in defining the need. This wasn't reflected in the fast track request because that was more about commodities, but we as a country team made sure that there was PPE in there for all the community outreach workers and additional per diem so that outreach worker numbers could increase because Nepal has been through a series of lockdowns. So we could make sure that was in there. And then when it came to the full funding request, then we're looking not at a 2 or a 3 month timeline for those, but for a 12-month timeline, plus the expanded set of activities that have been requested by the communities. Thank you.
Thank you, Nicole. And just to add to what Nicole said, you can please contact the CRG SI platform, so APCASO, of course, and also directly Gavin here and Gemma, who are on the call, if you need TA to support you during the grant implementation. If you need TA, plan ahead for this, and please immediately come up with the requests. The cutoff date is going to be the 31st of July. So I just wanted to finish on that. And thank you very much. And again, thank you to Gemma for helping Nicole and I with these slides.
Great. Thank you so much, Joe and Nicole. Really wonderful to see both of you again. And thank you for the sharing and the update. I think it's really encouraging to see, at least while it's very limited proposals that you're doing analysis, but there seems to be improved engagement, and also in terms of community priorities, including programs and services addressing gender-based violence and other aspects of community-led monitoring as well. I think would be very interesting then for us to move to our next session, the couple of sessions where we'll hear directly from our country partners who've been engaging in the C19RM funding request development process. And to hear a little bit more about some of the specific examples of how they have been able to engage, but also to feedback on some of the challenges as well. And hopefully that will also help Global Fund as you move forward with your further analysis later on. Too. So let me, sorry, I moved very quickly on to our next session without opening the floor for question and answering, but do put your questions in the chat box. I believe that Yo and Nicole will be with us for a little bit longer. So I would kindly request both of you to have a look in the chat box as well. But let me now turn the floor over to the APCASO Senior Program Officer, Mangala, who actually spearheaded the C19RM project from our end and who has done an exceptionally fantastic job in providing support to our partners and helping us get the whole project going in such a short period of time. And it's just been really impressive seeing how Mangala has been able to do the work that she's been doing. So the floor is to you, Mangala, and she will kick off with a bit of the regional context on C19RM for us in Asia Pacific, and also introduce our partners from Pakistan and Indonesia. So over to you. Thanks, Mangala.
Thanks, Jen. Hi, everyone. Good afternoon. So I will start off the session today just sharing with you some perspectives from the regional side on some of the lessons learned and some of the practices that has come out from the C19RM engagement so far. Next slide, please. So I think Jen has already given you an introduction, and a lot of most of us in the room already know about the C19RM, what the response mechanism has reached out to do, and what is it that we wanted to achieve, and to ensure that the civil society engagement as well as the community engagement is there in the second phase of the C19RM funding request. So APCASO then as host of APCRG as well as ACT AP with support from CRGSI then mobilized country partners. So through webinars, info materials, financial support, and other needed technical assistance as they came up to ensure that the inclusion of members of key populations is there in the process of developing the C19RM funding request. So we provided support to 10 countries in the region. After I'm done, you will be hearing from all the 10 countries on their very specific country experiences. But before that, I just wanted to take the time to share with you some regional and broad learnings that we have been able to capture so far. The next slide, please. So I'll start with the first one. So one of the first lessons, challenges, opportunities, whatever you want to call it, has been time. We worked against very, very tight timelines. As you know, all this started in April. So within 3 months, there was a need to move really, really quickly because the nature of C19RM was such, time was critical. So everything needed to be planned and executed very quickly. So this was especially tricky for our country partners that made their submissions in Windows 1 and 2. I do apologize. I think I bugged all of you quite constantly during this period, but we had to move fast to mobilize so that the voices are then able to be channeled to funding requests in time. So country partners were themselves at that point dealing with a lot of other immediate needs of their constituency, which is related to COVID-19 situation, especially countries like Nepal, India, and many others. So it was like a balancing act between that and then facilitating this community consultation. So time was so critical, and the need to move fast was there. The second point that I wanted to share with you is the need to being in the know of the country level process flows and timelines. Now, again, this was especially critical, and I think our country partners were quite amazing because they needed to be very vigilant and regularly updated so that the consultations that were being planned were in line and would fit into the timeline of what was happening at the country level. And information was not always that forthcoming. It was not always easy to get information from the countries sometimes. So this sometimes meant needing to mobilize within a very short notice. And in the time of the pandemic, it has not been easy. The third point here is the timely and extensive information sharing due to the new mechanism setup of C19RM. So not many of us have been involved before and were aware of it, mostly at the country level. So information and how it works needed to be disseminated widely and quickly through various channels. So communities then understood their crucial role in making their voices count. Now, again, this was a little bit of a challenge because a lot of people just did not know how it worked, and they did not know that they had this very crucial role to play. So the webinars helped, and then constant communication between our country partners and the communities was crucial to ensure that this happened quite well. The next one is the financial resources to support mobilization of country partners. Again, this we felt helped to address the resource gap that a lot of our country partners face in mobilizing communities. And we think this actually should be considered a modality that needs to be replicated in future. When we say that community engagement needs to be there, it's promoted, it's encouraged, then we need to ensure that the resources are there and is available to do so effectively, because it's not going to happen otherwise. Because to mobilize communities, to bring people together, to convene, to consult requires resources. So that's an important lesson. The next one is the need to adapt community engagement to the context of the country, including COVID-19 related restrictions. This is another challenge that I think our country partners were just quite amazing in overcoming, because we needed to tailor an engagement plan that worked best in the current scenario, keeping in mind challenges like lockdowns, movement restriction, and in some countries, an ongoing cyclone. So that meant that most partners were not able to mobilize in the usual way that they were used to. So there was a need to find alternatives. There was a need to find mixed modes of interaction. And at the same time, not leaving out anyone due to the digital divide, because not everybody had access to online, platforms. So that meant a lot of our country partners then, they were just quite amazing in trying to mix the physical meetings with the online meetings. Next slide, please. Right. Sorry, I lost the screen. Okay. So the other thing that we found was useful was the info resources to support partners in narrowing down the priorities and identifying recommendations at the country level. Now, this includes the one that was developed by APCASO. We developed 3 info resources on TB, gender-based violence, and human rights barriers. But we also worked in collaboration with other partners to develop advocacy alerts. And then we also then were able to disseminate resources that were generated by other platforms and other technical partners. And we think this was especially useful because all of us just were not able to, formulate and generate too many resources because of the timeline that we had. So it was really useful that, different platforms were coming up with like toolkits and all, which we could then adapt and share with our partners. And we think that partners greatly benefited from this as well. The next point that I want to talk to you about is working together in coordination to pool available resources. Now, this again was something that we realized as we were moving along with our planning. Country partners were approached by different support providers and funders who also wanted to do quite similar work. So then it was important to sort of synergize efforts, keeping in mind capacities of our partners, not to overburden, but as well as to ensure that we were not having unrealistic expectations of our partners. So we then linked up with the support providers, and then we linked them up with our partners. So I think that worked very well, because then we were able to sort of stretch the resources that was available to its best possible extent. The next point, I think the next important lesson is the linking of the strategic linking of diverse key and affected populations together. So again, there was an urgent need to ensure that groups or communities that were already working within with the community on the ground were linked to ensure that the process was inclusive, as well as no one or no issue was left behind. So we realized, for example, because I think I mentioned to you earlier before, we supported some consultations that were general across the 3 diseases, but also, like, for example, the TB specific consultations. So then linking up with groups that were already working on the issues on the ground really helped, because of the time limit that we had. So it really made a lot of difference on the ground. The next realization we had along this process was the fact that the close coordination and communication with the CCM in the countries is especially crucial to ensure recommendations are included and resourced in the funding request. It's one thing to mobilize, to consult, to come up with recommendations, but it really is another to ensure that whatever that came out is there in the funding request. And this especially, some of our country partners were quite uniquely placed with direct access to their CCMs and the writing teams working on the funding request. So this meant that they had more access in ensuring ask and demands are followed through. But while others found different methods of communicating the recommendations, when our country partners talk about this in more detail, I think you'll get an understanding of this means. But we realize how important it is to have that channel or that platform to be able to communicate with the CCM in the countries. The other point that I think it's also important to highlight here is the constant communication and coordination with the CRG team and the country team. So thank you again so much to the CRG team, because everything was happening so fast. So it was important for us to then get timely information or support from country teams through the CRG team. So this constant updates to the CRG teams also worked in terms of highlighting barriers and bottlenecks that we found out from our country partners. So this quick reaction and this turnaround time of response was also very, very important. So whatever could be dealt with immediately was done. So, but some other issues needed a lot more, interventions. The next on my list would be the strategic positioning of issues. Again, we realized as we were working on these specific issues, for example, gender-based violence, as well as the human rights barrier, not every partner is traditionally used to working on these issues. So we needed then to ensure a way to package it in a way that it would work on the ground with existing mechanisms on the ground, because issues like GBV it requires long-term efforts. It goes beyond COVID-19, so we needed to ensure that we included it very strategically to ensure that it wasn't just going to be like an inclusion, but a meaningful one, a holistic one. The next point I wanted to highlight here is the low uptake of available technical assistance. So we knew that there were technical assistance available, but the uptake for it from our country partners when we proposed it to them was not so encouraging. I think this is largely because of the tight timeline and competing priorities. So because of the tight timeline, it was already challenging to mobilize diverse communities in the time of a pandemic. And sometimes having a TA provider on board tends to be quite challenging, because this meant channeling energy and an effort to support the consultant, because it does require support from our country partners, which for many was going to just be, too much work and something that they were not able to handle because there were a lot of other things that needed their immediate attention. So as a result, only one C19RM related TA has been launched and carried out from the region, and that is for PNG. You'll hear more about it when our partner for PNG shares his experience. Can I go to the next slide? Right. So, and I think the most important lesson of all is the fact that investment in community engagement is an ongoing and long-term agenda. So while we understand that dedicated support and resources for targeted efforts like C19RM is, of course, essential and needs to be made available, we should not forget about the need to support such engagement and capacitating as an ongoing effort. Because one of the things that we have realized on the ground is the capacities of communities and civil society partners to mobilize in a time like this, and the degree to which the environment or the political environment or the CCM setup in their countries were enabling or not is quite dependent on how strong the existence or the non-existence of the civil society mobilizing capacities are. So we need to ensure that our community engagements, it takes time, it's ongoing, and it's a long-term investment. So I think for us at APCASO, this has been our biggest lesson. So in a nutshell, those are the lessons coming from a regional perspective. I hope I wasn't going too fast, but that's also because I wanted you to have more time to listen to our partners now share with you more specific and very, very specific examples or rather very specific lessons that they have learned during this time. So without further ado, I will now call on our partner from Pakistan, APLHIV, to share the Pakistan experience with you.
Hi, everybody, once again, and thank you, Mangala, for allowing me to, share my experience and also some of the barriers and the challenges that we faced during this consultative process. But before coming on to that, let me thank APCASO and the team at APCASO for their wonderful support for this important strategic movement. We are really humbled and thankful for this support and guidance throughout the process. So, coming on to the experience sharing from Pakistan, kindly next slide, please. So we started off with the process somewhat in April 21, once the allocation letter was shared to the CCM, that the funding is available and the allocation letter as well that was shared. So we started off with that, but basically and honestly speaking, we didn't have any direction because this was something new, that how to proceed and from where to proceed. So this was the time, I think, once APCASO came in with the guidance, with a couple of virtual meetings, and that made us pretty clear that how we have to proceed. And then, we got the financial and the technical support from APCASO as well, which made it possible to have a very, very broader consultative process, engaging approximately 200 people, 200 plus people from all over Pakistan, from not only the HIV community, but also the representative from TB and malaria constituencies. And also, important thing was that, like we know that it is the responsibility of CCM to basically lead this engagement and ensure the engagement process. So as soon as we got in touch with the APCASO and we got the support, so what we did is that we informed the CCM and I requested them that let's collaborate and we do it jointly. So it had basically two advantages. Number one, that it would not be the repetition and the duplication of the efforts. And secondly, whatever we do, if the CCM is on board, so that will have ownership in totality. So right at the outset, we had close coordination and collaboration with the CCM that make the things really good. Next slide, please. So coming on to the experience, this was something new about which basically, like I said, that no one knew that what it is whether this, allocation from the Global Fund is to strengthen the current grants, or it is something that will relate to, the COVID-19 and its impact. So different people had different thoughts. So, but like I said, that once we got through with APCASO team, so we were crystal clear, and then we started not only, following the things as per the guidelines, but also, started, guiding our colleagues at various organizations, at various forums, that this is how it has to go on. And this was the time once very clear instructions also were shared from the Global Fund side, so that make the things more easy. So I think this was a, kind of a tough experience that, you are going to do something that is not very clear right at the outset. And the second thing that we had all the leadership at the National AIDS Control Program and Common Management Unit. They were basically new. And obviously, once a person is new at the stage, so he or she is not fully aware of the processes, particularly the technical aspects, particularly the importance and need of communities and civil society engagement in the Global Fund processes. So we have to really, advocate for it, and we have to, guide them, rather I would say, that why it is important to have a consultative process, and why it is important to engage not only the communities but the civil society as well. So that was, I think, something that we experienced, that was a new thing. Then, like I already said, that we collaborated right from the outset with CCM Pakistan to ensure that all the process has ownership and to avoid any duplication of the efforts. And during this process, because of the internal policies of CCM Secretariat, they had to, inform the CCM chair, who is also the Secretary, Ministry of National Health Services. So he was also directly engaged in a way that he not only, allowed the CCM Secretariat to take part, but also, we had kind of ownership from his office as well. So I think that turned to be very positive and supportive at the later stages. Then, if I talk of the grassroots level, so there was again confusion that what this, funding request is actually for, whether it is to, support the implementation of current grants, or whether it is something that has to focus on to the COVID-19 and its impact. So like I said, that with the passage of time, the things got clear, and this was also ensured once our consultative process, that started. Then the APLHIV also engaged all the, key stakeholders from the key populations, from the civil society, and from all three diseases. And I think this was the beauty of the thing, that these over 200 participants from all over Pakistan, they represented three diseases as well as the civil society, and those engaged in service provision as well. Then the national networks and key organizations representing the TB and malaria constituencies, they were totally unaware, and this was even shared during the CCM meeting, that they were unaware, and they appreciated this initiative of the APLHIV, and they shared their appreciations and compliments. And again, basically, I would say that credit goes to APCASO, because they were the one who were behind the gun. Then all the civil society organizations, key populations, and all the three diseases CCM members, they were engaged basically during the entire process. So we have, four civil society civil society CCM members in CCM Pakistan, representing the civil societies of 4 provinces. Then we have one key population representative, and then we have three, CCM members from 3 diseases. So all these were, successfully engaged by the APLHIV in all the consultative process. So this was basically done with the thought that, once the things come up, and the draft is, shared with the CCM, and once the stage of CCM approval comes in, so we have the support, we have the alliances, we have, somebody at our back to support what all was to finalize during this entire process. Next, please. Then important thing, I think it was, despite COVID-19 and engaging AIDS, TB, and malaria constituencies, it was ensured that each of the key population was adequately represented. So like I said, that our consultative process engaged all the 3 diseases as well as the civil society. So this was a kind of a broader I would say engagement and representation. But even despite of all the difficulties and challenges, we ensure that the key populations have adequate representation during all these consultations, and we had very successfully organized all these, I think, 8 consultative sessions across the provinces, and then one was at the national level. So all the key populations and the 3 diseases and the civil society, they were well and adequately represented. I think that was something that was more satisfying for the APLHIV, that we were able to reach out all the key populations and people in need of services. Then we also ensured separate meeting with all these key populations to ensure that their voices are very clearly, recorded and communicated and reflected in the funding request as well. And all the community-based organization engaged in provision of services, they actively participated, and they even kept sending their viewpoints even after the consultative process through emails, telephone calls, and WhatsApp, etc. So already, like I said in the intro and the background, that almost over 200 participants representing civil society and 3 diseases, key populations, they participated during this consultative process. Then we had basically planned that a national consultation would be called in to have another review of the things. But then we coordinated with the Common Management Unit to manage the Global Fund grants. So that is the CMU. In collaboration with CMU, again, we organized the national level consultation, which was also attended by 3 program managers, as well as the national coordinator of the CMU. And during that, national level consultation, what all the process that took place under the banner of the APLHIV, the consultant came up with a draft report, and that was presented. All the participants appreciated, and all the participants supported that. And during that national level consultation, in presence of national coordinator and all 3 program managers, the same was endorsed by that national level consultation meeting. Then a comprehensive report based on this consultative process that was developed by the consultant, which was acknowledged by all the stakeholders, and that is the final document that has been shared with the writing team, as well as with CMU and CCM Pakistan. So basically this all activities took place at a time once the 3rd wave of COVID-19 was at its peak in Pakistan. That was number 1. And we were expecting, total and a complete lockdown, anytime. This was a major challenge. And, like Mangala said, that we had, time limits also, that was a challenge. And moreover, it was also the month of Holy Ramadan, which, obviously reduces the working hours as well, and makes a bit difficult for people to, fasten and then to attend such meeting. So what we did is that, realizing and keeping all things in mind, we started off with, the process after, consultation with the potential partners, and we started off well on time, and we concluded, I think, 3 to 4 days before, once the complete lockdown was announced. So we were successful in that approach, and in imagining the things. If we would have not done all this before that, so might be our consultative process would have been affected. So that approach was there, and we, through this approach, we addressed all the issues, and we ensured the maximum participation from all the participants and the people who were invited. Next, please. So, like I said, that it was time once the 3rd wave of COVID was at its peak. It was only month of Ramadan, limited. So another basically problem was that in most of the cases, the really grassroots level key populations and disease activists, in most of the cases, they were deprived of internet services for one reason or the other. And it was again an issue that, if somebody has, but how to use it, that was, another problem. So we had the experience of, carrying out the consultative process in the same like condition last year, once we were, preparing for HIV funding request. So based on that learning, basically what we did, that we, adopted a kind of two-way methodology to hold the meetings and the consultative process. That was, we also engaged the people virtually, and those, from our point of view, from the point of view of key stakeholders, those who were important to be included, but they could not join due to any reason virtually. So we ensured their presence physically as well. So this was a combination of physical via, versus virtual meetings, and this, team worked very well. So we ensured that, this challenge is, addressed that way, and nobody feels that he or she is left behind. Then again, there was kind of lack of expertise in most of the cases to use the devices that I already talked about. Then I also talked about the time, tight timeline and other activities that were basically going on. So, this all was a challenge, but by one way or other, the team at the APLHIV managed this, and I really appreciate the entire team for their support and work around the clock to make it a success. And then again, what we experienced is that once we contacted various key population, so, time stability, that was different for almost each of the key population. They, had a kind of a diverse proposal for the timings to hold the meetings. But again, counsel them, advocated, and, finally, we got it, all the key population at the required time, keeping their limitations in mind. Then it was also very important, and to some extent it was kind of a challenge that, like I said, that the people, they were not much aware that on what issues basically they have to give the feedback. So the consultant was very supportive in this particular case, and we developed a kind of a questionnaire to keep the discussions on track. And we also took a bit of time in each of the meeting to make the participant understand that what basically we are, going to do, and on what issues we require their feedback. So next, please. So these are some, pictorial views of different consultation. For example, this slide shows the consultation that was, conducted in one of the provinces named as Balochistan. So on one side, you can see the people who physically participated, and other side, few of the people, who joined us virtually. Next, please. So this is the another province, that is the Khyber Pakhtunkhwa, bordering with Afghanistan. So this is on one side the people who joined us physically, and on the side the people who joined us virtually. Next, please. So again, this was the Punjab province. Again, virtually versus physically. Next, please. And this was something in Sindh. And we also, like I said, that engaged the key populations, but for the confidentiality purposes, and like we didn't have the consent to share their pics. So I am just, leaving that out to show the pictures of the key populations. But in the supporting document with the CCM, those all pictures, they are shared. So I hope this was the last one, or we have another slide. So that's it from my side. Once again, thank you for being patient to listen, and thank you APCASO team for supporting us during the entire process. And yes, last and final thing is that initially we were told that the submission window would be of 15th June, but it is now the email that we received from CCM Secretariat is that now Pakistan would be submitting, the funding request on 30th of June. So in previous first presentation from the Global Fund side, Pakistan was also, in red line. So just, a kind of information that I'm sharing, that what information right now I have is that we are going to submit on 30th of June. So thank you very much for this, and thank you for being so patient to listen. Thank you.
Thanks so much again, Ashkar. I think Mangala just got dropped off on Zoom, so I'll just take over a little bit facilitation. So thanks again, Ashkar. I think every time, I mean, this is really from the bottom of my heart, that the work that you and your team do in Pakistan is just incredible and just so impressive. And I think, you know, the extent of the consultation that you were able to carry out, I think just completely blows my mind. So thank you so much for taking the time to share with us, you know, your process and some of the key lessons and challenges learned. I think various components of what you share was reflected earlier in Gil and Nicole's presentation, but I think they were really, I mean, I think the richness and the additional details that you share was very, very valuable to us. Let me, just before I introduce the next speaker, let me just remind everybody that we have an open mic session at the end of all the presentation from our partners. So that if you would like to keep your questions till that time, and to contribute to the discussion at that point, then please do so. You have that opportunity as well. Or you could also put your question in the chat box at this point as well. So just to let everybody know, there will be an opportunity for an open mic session. Let me quickly move on to our next speaker, and that's May from the Indonesia, from JIP. Can I let you introduce yourself and the network in Indonesia for us? And over to you. Thanks again for being with us today, May.
Yeah, thank you so much, Dan. Hi, everyone. I would like to give our appreciations to APCASO for the wonderful collaboration during this process. So I will present our advocacy work about the community response for COVID-19 funding requests in Indonesia. So my name is Merinda Sebayang. I'm the national, the chairperson of the National Network of People Living with HIV in Indonesia. Next slide. So our positions in the response of the development of funding requests of C19RM, as a member of the CCM, our organization, GIP or JIP, we have to ensure that the involvement of people living with HIV and also key vulnerable populations in every level of national HIV response, from planning to monitoring and evaluations. So we has adopted the CRG strategic initiative and also community-led monitoring and advocacy to strengthen the civil society and the HIV community in the processes related to the Global Fund process, including the C19RM funding request. So we had conducted a series of community consultations because we want to provide more opportunities for the key vulnerable populations, people living with HIV and also TB survivors, including our key young populations, to understand the development process of the C19RM funding request. So we engage with the almost 400, around 383 individual participants from 81 organizations, which consists from the CSO, the CBOs, the networks, the peer support groups, and then we conducted into the 16 meetings. Next slide. So most of the consultation meetings conducted virtually using the Zoom meeting applications. Several hybrid meetings also being conducted in Jakarta area, especially for the people living with HIV who affected a bit with the COVID-19 and also the key vulnerable populations. So for us, the critical success in running 15 meetings, because we have a collaboration work not only with APCASO, but also we got support from the GNP Plus, from Input, and also from GET, and our key population network also get support from the Youth Lead. So this is a teamwork, this is a robust collaboration, partnership, and optimal use, and also optimal use of the technology that we have right now. So we took advantage of the paid Zoom application because we want to engage more people and we have more flexible times, and also because we have a lot of meetings and a lot of collaboration with other networks and organizations. So we also use the Google Drive application. So each writers and also consultants will send the reports to the Google Drive so everyone can read and everyone can provide inputs to improve the reports. So, but also we have we identified the obstacles, of course, during this process. Some participants have problems with the internet network, time difference, especially in for our community and our friends in the east part of Indonesia. And also, like Asgar mentioned before, that the proposal language is quite difficult for community to understand because there's a lot of new terminology, there's a lot of new definition that we need to learn together. And also because we have a very limited time, we have a very strict time, and also resources of the committee. So this has become one of our obstacles during the process. Next slide. And then we try to find the solutions to overcome about this situation. So our organization tried to replicate the proposal content. We try to summarize it and translate it into Indonesian language, and we try to replace the terminology, the difficult terminology that were easier for the community to understand. And also one of the successful of this process is because we try to engage and have a collaboration with the national networks to carry out these consultative meetings. So the network members can support us to provide the personnel to help us in conducting the meeting. So we work together with the network of MSM community, the network of women living with HIV, the networks of sex worker, the network of people who use drugs, the network of young key population, the networks of transgender, the network of TB survivor, and also some of TSO, including our close friend of community PR's Spiritia Foundation during the process. Next slide. And the challenge and opportunities in lobbying advocating, like I mentioned before, we have a close relationship with the community PR, which is Spiritia Foundations, and also PR's candidate, which is Indonesia S Coalition. So we also have a consultative meetings with the PRs, and this becomes an opportunity for advocacy during the recommendation dissemination process to the CCM and also the proposal writing team. So after the consultation meeting with the CCM, we personally engage with the PR community to identify which area that can be at the recommendation from our process, and then can improve the funding request of C19RM. So the result of this recommendation then submitted to the technical working group of HIV and also the proposal writing team and also Ministry of Health on May 25th, 2021. And also the result of the TB community consultation also have been presented to the writing team for the TB component. And then before submitting proposal, also our community member of CCM lobbying process try to lobby the writing team and also the other CCM member because we want to ensure that the recommendation, some of the recommendation can be added to the proposal. Okay, next slide. So during the process, we also have a joint consultation meeting because we want to identify which part of our recommendation that already being added to the funding request of C19RM. So from our analysis, we found that from 27 recommendation points, about 66.6% or almost 67% were covered in the proposal along with the proposed budget allocations, and then more than half, almost 60%, fall into the above allocation category of all the proposed and budgeted recommendation points, especially for intervention related to responding of human rights and gender-related barriers to services. And then also recommendations under the COVID-19 impact mitigation intervention are found as the most widely included in the proposal. Still, recommendation related to the use of technology to adapt HIV services and program activities were least accommodated. This is some part of our key recommendations. We try to put them in 4 thematic issues. First, about COVID-19 risk mitigation measures, and then adaptation of HIV services, and then also support for the community response system, and also utilizations of technology for adaptation of HIV program and service delivery. Now we are on the stage of finalization of the report, and then we will send it to our partner, especially for APCASO, GNP plus GATE, and also input. Next slide. So our recommendation to improve civil society and community engagement for future C19RM cycles. So from our experience, discussions with the CCM and with the community, it happened one day before the proposal was submitted. This shows that the C19RM proposal had not significantly placed the community at the center of needs and responses. I mean, the process of the developing C19RM proposal has not significantly placed community at the center. And also the transparency during the writing process should involve the community long before the submission process. So the funding request is not based on the eyes of the program implementer only, but based on the needs of end beneficiaries. And also capacity building and community involvement related to funding requests and continuous access to proposal and budget documents can be carried out. In addition to increasing community knowledge, the role in monitoring and overseeing during the grant making process until grant approval will be more optimal. And also, it is essential to maintain regular communications with governments and technical partners to communicate the needs of key vulnerable population, including people living with HIV during the pandemic. And also, the strong collaboration must be enhanced and maintained between the communities and CSOs in the country level with the Asia Pacific regional and also global organizations. So with the strong collaborations, then we can ensure that the voice of the community can be addressed to the proposal. I think that's it from me, Jen. Yes, and this is our meetings with the transgender community and also people living with HIV and also some of the CSO. Thank you so much. Over to you, Jen.
Great, thank you so much, May. And again, I think, I mean, the extent and the comprehensive of engagement and just that sheer number of communities and civil society stakeholders that you were able to engage, close to 400. It's just incredible, and especially, you know, during the time of pandemic and the need for us to all learn the technology issue. So thanks again for sharing with us. And I think what was very interesting for me, it's that slide that where you were able to do some analysis around how much of the community recommendations was included in the funding request going to the Global Fund in the end, and some of the breakdown. Just to mention to the group here, and maybe this is a good place, that we're hoping also to do as part of our contribution to the analysis on the side of APCASO and APCRG. We're also hoping to come up with a brief paper after all the consultations have completed, and part of that analysis will also be for us to look at, you know, how much of the recommendations coming out from the community consultations was taken up in the funding requests in various countries. So thanks for sharing that information with us as well, May. Really appreciate it. Let me just, in the interest of time, and apologies that again we'll have an open mic session, but I am eager to share and to give the floor space to our next few more speakers, for them again to share with us the key lessons they have learned in organizing communities and civil society consultations in their respective country, and also the challenges and opportunities in advocating for community priorities in C19RM funding request development, specifically what worked and what did not work, and what are some of the things that that needed to be learned, and what were some of the key outcomes. And after this next set of 4 presentations, we will then have an open mic. So the next speaker that we have prepared for you is Leslie from Papua New Guinea, who helped coordinate the key population advocacy consortium and the extent of consultation, and especially in the context of PNG and some of the geographic limitation, has also been really just really impressive, and I think very different context, but I think some really valuable lessons learned for all of us as well. So let me now turn the floor over to Leslie. Leslie, I believe you're online with us, and please take us away and yeah, with your presentation. Thanks.
Okay, good night, everyone. It's evening here in Papua New Guinea. Thank you, Jennifer. I'm Leslie Bola, and I'm the Key Population Advocacy Coordinator in Papua New Guinea. Next slide. So just to give you a snapshot of what's happening with COVID cases in Papua New Guinea, we have over 17,000 cases now, and our recovery rate now is 16,396. That's those statistics are taken from yesterday. And in terms of deaths, there's 173 deaths. So far, we haven't had any deaths within our communities, and these are other deaths from people who have other underlying conditions, I understand. So in Papua New Guinea, the Key Population Advocacy Consortium is made up of the 3 network groups, the people living with HIV, our couple champions, men of diverse sexuality, and French Chicane, which is our sex workers organization. So in terms of interventions, mainly due to restrictions around here, we try to utilize Facebook in terms of giving out information to targeted information to our groups, and also we're utilizing our peer outreach workers who are funded under Global Fund to also do awareness around COVID, and also we use opportunities that we can grab on when we have meetings and workshops. So the consortium has been really proactive in terms of our COVID response, in response to the CSO communities. And prior to this process, we took the initiative to do 2 surveys. And the first one we did was the rapid assessment for people living with HIV. And the second one, the recent one, was the COVID-19 accessibility around the survey around the vaccination. So to me and our team, this information has been really helpful to us because we're using some of our data also to help with the process of planning our COVID response. This data has represented communities from around the 20 provinces. So in some ways, they've actually had a voice in this process. So somehow it happened at the time where we already reached them prior to this process. So we gave this information to our consultants also to use when they did the desktop review. Next. So just some information around issues around COVID in Papua New Guinea. All this information we've gathered here from surveys and also from information we've taken from around the country. So there's a decrease in TB, HIV, and STI testing due to the restriction of hours. In terms of our commodities, we have our testing kits and a few other commodities that are stuck at the wharf, but I think to this date, we've managed to get some out of the wharf, and then the government is still trying to get others, and that's due to some bureaucracy or funding issues that our government's supposed to do that. Communication has been a very big challenge in Papua New Guinea. The high cost of our data internet because of the monopoly. There's only 2 servers who charge very ridiculous prices. So that's a big challenge for us in Papua New Guinea. The KP prevention and treatment program around TB&H, there was a delay with the new contracts. It's now underway, but it started slowly at the beginning of this year for the last 6 months. But we understand that things are picking up now as of I'm speaking today. And there's also restricted movement with people with HIV around. Any programs that's happening because of some of the restrictions by the government not to travel to other provinces. So we're using other opportunities where we can reach out to our communities. Okay, next. So in terms of the process, how we went, we were very privileged to have UNAID as our mentor and a resource vehicle that helped the CSO community engage and apply. We put together an application form to get a consultant. So we were lucky to have someone who was signed up for us in terms of preparing the paperwork for this. At the same time, APCASO also helped us with some funding to mobilize our communities. So we also used that opportunity platform to mobilize communities. We also use so many information around COVID that's been documented by other donors. We've used desktop reviews so that we can get information also that has been captured by other sources. And also with the consultation, with the funding that we got from APCASO, we were able to travel to 3 main provinces that there's high rates of HIV and TB in these provinces. So that National Capital District, Morobe, and Eastern Islands. So we had arranged a virtual call with the consultant. And in the process of doing 2 consultations, we were able to get some of the type of questions they would ask. And so we replicated that with other provinces that weren't able to join in the virtual call to get also some input from the other provinces. Also, we had the consortium supported by we had, because of the virtual call, it can be challenging for someone who's from outside PNG. So there were lots of reflection on these virtual calls where there was clarifications with the consultants so that we spoke the same language, we understood what the point. So that was one of our challenges, but we were able to do reflections after those meetings. We also linked the consultant to the national grant. So in Papua New Guinea, we have a national grant, and the CSO grant that's going in will be part of the big grant. And we were supposed to, the deadline for this was supposed to be in June the 15th, but because the other components was slow, the malaria and TB components didn't meet the deadline. So we asked for an extension. So our application would be lodged on the 30th of June this month. Okay, next. So these are some of the positive notes that we've got from learnings that we've got from this process, and we're very privileged to have some of the information that APCASO shared online, and that really prepared us as leaders to start this process. The information that was shown, we were proactive in reading them ahead of time, and then we understood the whole process that happened. And even from Global Fund, those very basic instructions that were given were really helpful for us and the community to understand. And we translated it into our own languages, so the communities understood that. We know in Papua New Guinea that there are lots of funding that's coming from different donor agencies, and the consortium plays a role where we ensure that there's synergies around the programs that we run, and also there's no duplication. So the consortium is an eye with all the donors. So we get everyone together and we do a mapping exercise to see where are the gaps, so we we can fill in those gaps. So those gaps, we use this opportunity to fill out some of the activities that were missing in. So there was very clear, collaborated and coordinated work done with the other donors. And we had to explain that to everyone so that everyone understood the process and we were able to speak the same language. One of the challenges, I'm going to go through some of the challenges. Our consultant fell ill in the halfway through the process, but we were lucky that she had started the process and we learned some of the processes, some of the questions that were asked. So we continue on with that. So we had a plan B around involving other provinces to get notes, and we were able to put together the notes. And as we speak now, our consultant is back together, so we're going to finalize the paperwork. So we left it to the person who was writing the national grant, and he supported us through the whole process to document all our information. Internet accessibility in Papua is quite an issue for everyone. Not everyone can be reached online. The virtual calls, only certain people can use that, especially after hours, because not everyone has got a smartphone or a laptop. So we try to use some of the opportunities we have to use internet to communicate, like tonight. The time framework was really short, but we made sure that we got as much information to finalizing the contract that was available, and also the teamwork and the support from our mentors in Papua New Guinea really helped us. And one thing I learned from this is just constant communication and clarification that helped the process go through. The CSO was not only CSO is not only the C19 grant. However, there's a big grant that I mentioned earlier on that Papua New Guinea is going to put together and then submit at the end of June. Next. So this is just some of the topic areas that we discussed. And as you all know, gender-based violence is a big issue in Papua New Guinea. So in terms of specific activities, we want the consortium to link with the existing gender-based violence services so they can understand where we're coming from. We can share resources, and we can also help them understand our situations, sensitize our gender-based violence services so we can refer our communities to the mainstream. So around gender-based violence, we're working on that and the SOP, developing an SOP for that. Human rights, we want to empower the communities to know their rights. And now with the COVID coming on board, there are lots of issues around human rights. So we want to link them to existing human rights programs so they can be part and parcel of what's implemented on the ground. And we are using data to actually do targeted information. Next. I think that's about it, very basic stuff. And by the end of this month, we'll be able to know exactly what has been in that application form. Thank you, Jennifer.
Thanks so much, Leslie, and thanks also again. And I know that you always get the most unpleasant end of the time zone situation. So thanks again for joining us. I know it's way past the end of your day, but I think one thing for me in terms of working in PNG and the work that you do, it's really one of the key challenges has always been around, especially in time of pandemic, how do we resolve the issue around technology? And I know that with previous, even with the Global Fund strategy consultation that we did, that, how do we organize virtual consultation, making sure everybody could join, whether that's a group of people sharing one phone together to be on the call together, or making sure people actually have resources, money for purchasing of data. I think that's one thing that sometimes that we do take for granted in other parts of Asia where technology is a bit more accessible in comparison. So thank you again, Leslie, for sharing with us the experience from PNG, and again, really appreciate the incredible work that have taken place over there. Especially, I think I was quite happy to see, you know, the emphasis on making sure interventions around gender-based violence and also, you know, addressing human rights related barriers were also included in your recommendation. So thanks again. Let me then move without further ado, introduce our first presenter, the next presenter, which is Daksa from the National Coalition of People Living with HIV in India. And let me just turn the floor over to Daksa to introduce herself and NCPI Plus a bit more, and then to further share with us the Indian experience. Over to you, Daksa.
Thank you, Jennifer, and thank you all. Myself, I'm Daksha Patel from National Coalition of People Living with HIV in India. So in sharing of this experience of C19 grant process, we had in a different community consultation with the TB and people living with HIV community members. And our team member is also part of core committee of formed by CCM India. So I'm moving in my presentations, which explain more about what we did in C19 RM process. Next, please. So this is our major experience and learning in India. We had a process community consultation with different with different community member participation as a national consultation we conducted in country. But that was very big challenging time, specifically in some part of country, because it was a high COVID infection in country is overall country scenario. And in the same time, there was a biggest challenge about uh, uh, we have like issue of it's about the it was like not good time for us because we lost a lot of our community friends and our doctors, even our people who are care provider in our hospital setups. But yes, we came over in a very peaceful now. At least we are in a smooth time. But this PLHIV national consultation, we had a key population and we had a member from CCM and vice chair and other CSO partners also we engaged in a PLHIV consultation. And in TB consultation, we had a PR and TB affected and TB survivor community member in consultation meeting. So approx total 45 members are participate virtually because it was not possible to meet physically during that time. So across country, all states are participated member from different region and national level. And our member is a part of, as I mentioned, about C19RM core group process for very, very deep discussion in regards of C19 proposal design and draft. Which there was a number of consultation we part as a core group member. So around 2 CCM meeting and 5 official core group meeting was attended by our team. and a series of CSO and KP meeting in parallelly we had during this process of RM India grant designing and things. The basically outcome is about like we had a very specific key ask throughout our national consultation, and which one we also addressed and shared with a core group member from PLHA constituency and CCM constituency, living with disease constituency member. PLHIV key ask shared with a larger KP groups develop common community ask. In TB, we had a very good process. We completed in within like same day. We completed two slide presentation about key ask from the TB survivor, and we shared it to our vice chair and core group member for as our recommendation note. Our group core group member highlighted the specific ask including in the proposal and what exactly discussion was happened in our national consultation as well. So this was overall experience and learning during this overtime. Next please. Now about learning is NACO and PR shared the draft paper on very last moment. So it was very hard to study and give our proper comment because there was very hurry about push the for the approval. So it was almost like all CCM member, including UNAIDS, approved the proposal that limits the opportunity to push community agenda due to a very time shortage. Then it was we found and it was learned that consultant who was writing the proposal, they had very big role and influencing in a favor of PR. So there was what the exact the design and the thought came from the community. It was changed a lot of in different way, like big jargon or big different way of the uh, by the consultant. And most of community ask were put under like big words, and community like community advisory board or community system strengthening role was very limited. uh, like only community was utilized as a to mobilize the generate their ideas and inputs, but exact on the paper it was we not found what exactly discussion and the thought came from the consultation and asked from the community members. So that was a gap we find, and it was a big learning from community level for all of us. And role of we think that uh, as a uh, as a C19 grant is like not it's like emergency grant, and it needs to be it's like relief grant. And centrally we had a very good experience in last C19 grant. There was a like centrally the PR decided to they will procure the nutrition support, and it is very small amount, but the data was came through state or CBO or SSR SR level to PR. And that nutrition support to exact needy people, it is still under the pipeline, and it is 1 year was taken, but it is under the pipeline. And so many like it was learning about wastage of time, energy, duplication of work, and overlapping of role. So that was a major learning we found from last grant. But still we are thinking that in this scenario, after this all consultation, we thought that most implementation by SSR, SR or CBOs who are exactly working in the ground level with very closely near to community member, but still like there is a needs to very much clarify PR role in entire global fund implementation must be like restricted to technical support and fund management. It's really again if we will make a role of PR in implementation part, so I think it is again we will repeat the mistake what we did in last year. So this is the major learning in global fund. I want to also share here, it is not directly related, but it is co-related. FCRA rules in India now only people are, only the government is uh, uh, change the rule of FCRA. So under the FCRA new rule, like big organizations will not provide a fund to small organizations. They have to direct a role of implementation. So in that scenario, like small CBO or like KP organization or PLHIV organization, they may die because there is the very limitation of direct relation of implementation in the ground level. So this is the major learning throughout this whole process of CRM 19 grant and our consultation and community dialogue throughout the period. Uh, Please next slide. So that's it from my side, India, what we learned and what we did so far. Already, Mangala shared a lot of experience about country, what we done in the past. Now I am closing my point here, and my colleague Manoj is also here. So Manoj, if you want to add any point here, please quickly add.
No, thank you, Daksha. You covered everything.
Thank you, Manoj.
Great. Thank you so much, Daksha and Manoj, for sharing and for your time, for taking your time to share with us. And also, I think I really thank you for that sobering reminder of, the real impact of COVID-19 on the ground, it's a real sobering reality, the impact on our communities, on our friends and families, etc. I think what Daksha also pointed out, it's the issues around the shrinking civil society space that we are all facing in our region. And I think India is a really good example of, how policies have been evolving and changing and making it more and more challenging for civil societies to access funding, to do the work that they do. And that's why funding that the Global Fund it's even more critical, if ever, for supporting community-led responses in health. So let me then move on. I'm conscious of time. Let's move on. We have a few more speakers that we would like you to hear from. The next speaker up is Achu from Trisly Plus in Nepal. And I think Achu will again share with us some of their processes and also lessons learned and key challenges. Achu, over to you.
Hi, Jennifer. Thank you very much, Jennifer. And thank you, APCRG APCASO and ACT-AP for providing this platform to share our experience and learning from each other countries. So basically, today I'm presenting on behalf of the Trisly Plus. However, I represent Nepal CCM as a vice chair, but I'm not going to not present national presentation, but the Trishuli Plus, which is a community action group, and Trishuli Plus is hosting survivor group in 10 districts in Nepal. So in terms of the COVID-19 response mechanism funding application process, so Trishuli Plus took the lead from the community, because this is first time in Nepal that we have TB community, organized TB community, and it's not a long history in Nepal being, the TB community. So it's been only 1 year, and then we are trying to organize and bring TB affected community, TB survivors as a network. So Trishuli Plus is taking the lead. So I'm presenting on behalf of Trishuli Plus. Mangala next. Okay. So the main challenges during consultations. Once we received allocation letter from the Global Fund, so CCM, I already told that I'm not going to talk from the perspective of CCM, but from the perspective of TB community. So there was challenges. So as a executive director of the Trishuli Plus, and I had that responsibility to bring all the communities for the discussion and sharing the community COVID-19 response mechanism, funding application processes, and the all. So the main challenges was lockdown, because as you already, you all are aware about Nepal, that we are going through very critical time. So because of second phase of the coronavirus, so we have lockdown till this date. So it is difficult to connect people, bring TB affected community, because we already have limited, survivor groups only in some districts, and on top of that, so because of the lockdown and internet access, so it was difficult us to bring people in the consultations. And another is time constraint, because we after 15 days of receiving allocation letter from the Global Fund, we had to submit fast track funding application. So the time constraint. Then we had a 1 month time duration, time period for the full phase funding application process. Still, it was very limited time for us to communicate, to bring people on the meetings. So another constraint, challenges, because Nepal, so we have 3 layers of governments and so many concerned people and so many concerned stakeholders, and definitely disease entities and National Tuberculosis Program, and they have their own a mechanism in the ground level also. So we, National TB Program tried to engage all the the government, all layers of government, and all the concerned stakeholders as well as disease entities. So it was another challenges to engage all the stakeholders and government entities and disease entities. And another challenges was, so we had limited budget, because almost 50% of the allocated budget. So we put in the fast track application, and the remaining 50% was very limited budget. And but the priorities from the government, and that priorities from government, including vaccine and other equipment, it was a long list of those priorities, but we had a limited budget. That was another challenges, and as well as there were so long list of the priorities from the communities also. So it was challenges us to address all the priorities to reflect in the funding application. Okay, next. So what I it is my opinion that so it was opportunities for us as a national program. So there were lots of resource gap in national TV program, and we could not put all the priorities that were coming from the country dialogue during the main grant of the country. So this in this COVID-19 response mechanism funding, so we were able to, I mean, we took this grant as an opportunity to fill, those gaps and those resource gaps in the national program. Like, so there were lots of, gaps in activities, and because of the, budget limitations, we were not, able to procure, put all the, required needed equipment in the national TV program. But this C19RM, funding application, it was opportunity for us to, put all those gaps in the application. Another opportunity was as a host of the survivor groups in Nepal. So it was opportunity for us to engage, to know the community issues, through the community engagement, because we had to, to conduct consultations, and we got that opportunity to engage community, and we had opportunity to listen people affected and by the TV. And so it was opportunities, one of the opportunities. Next, Mangla. So the outcome were so we were able to able to reflect community-led and best approaches, especially because why I'm coding is a TV program, because I already told that, so I'm presenting on behalf of TV community and TV consultation. So it is our achievement that we able to reflect all the recommendation from the consultation, like community-led approaches, community-based approaches, like community-led monitoring in TV program, community system strengthening, and so network strengthening, network building activities, and bi-directional screening for both TV and COVID testing activities. And then we were also able to put bi-directional equipment like gene export, automated X-ray machine, CATES, KDC, and other equipments which were gaps in our mainstream grant. And then so this is the outcomes we have we able to do from our advocacy. And so additionally, so I'd like to inform you all that so we have submitted our fast track proposal on the last of April. And then, so we submitted our funding application on June last, maybe 31st June. But after a week, but Global Fund back to us with more, so they asked us for more ambitious proposal. We can, we could exceed the budget. So exceeding budget is also fine than the allocation. So today, so officially, Nepal CCM has submitted our full-fledged funding application today with 28 million, budget. So this is the information that I just received from the Nepal CCM. So that is all from my side, Jennifer, because I have lots of information in my head because of the I'm representing as a PLHIB representative in the CCM and also as a vice chair. So I have lots of information. So I don't want to mix match all the information here and there. So that's all from my side. Over to you, Jennifer.
Thank you so much, Achu. And I think you've been very modest about the critical role that you, in your multiple roles and the multiple hats that you wear in terms of the Global Fund and community engagement in Nepal. But thank you so much again for sharing the lessons learned. And I think for me, it's really to help us bring attention to look at how do we better engage TB communities in C19RM. And it's really wonderful to see that special focus on that community. But I'm also aware that the Nepal CCM has also made extra efforts to engage and support key populations from HIV to engage in the C19RM development. So unfortunately that we don't have the additional time for you to share about that process, but the attention on TB is much appreciated. So thanks again, Achu. Before I move on, I know that we are at the 2-hour mark, and that was really the initial plan. But I hope you will all agree with us. The sharing has been wonderfully rich, and we still have a couple more presenters, specifically from Vietnam and also Cambodia, that we would like to go on to share. And so if possible, for those of you who are able to stay, we would like to kindly request an extension of 15 more minutes of your time in order for us to finish up the sharing and to do a quick closing. Otherwise, again, the webinar, the recording of it will be made available later, and we will also be sharing the presenter slides as well later on. And you can find that information on our Facebook page posting and also as part of our mailing list later. But let me quickly call on our next speaker, and that's Wine from Vietnam, SCDI. And Wine is both the executive director of SCDI, but she's also the chair of APCASO's Council of Representatives. So it is with my great pleasure to introduce Wine and to help share a little bit about the Vietnam civil society and community engagement process and experience over there. So over to you, Wine.
Yeah, thank you, Jen. And can I have my slide, please? I am deeply humbled to speak up to on my community civil society college from other country. You've been doing so great. I mean, I don't have much to add. But just share with you some very quickly some of the experience and thought around this process. Next slide, please. So I mean, we live in a COVID time, and the C19RM funding request in Vietnam happened during the time that we experienced the worst wave of COVID in the country. Vietnam has for so long been like doing fairly well in terms of COVID prevention, but we are now having a kind of a big way, and people are in many ways immobilized or panicking. There's a lot of resource and attention put to COVID, but other than that, before the COVID, before this wave, there's not much attention to be paid at COVID, and people didn't feel so. In particularly the people in the decision making, who earn a government salary, whose life are not affected much beyond being some travel restriction and so on. So they didn't necessarily feel the impact of COVID. So their experience can be very different from the experience of the community whose livelihood is stopped by COVID, whose have to practice do some kind of risky practice in order to earn their living, whose treatment is interrupted, service interrupted. So there's the difference in terms of experience is really much more pronounced during this COVID time. So, and for the consultation for the C19RM funding request, because it happened during a COVID wave, there's a travel restriction, there's a meeting restriction. We was not allowed to meet more than 10 people. So that's why we have to do everything online. And many people mentioned the challenge with the online meeting and consultation already. But for us, we see that when we do an online meeting, whether it's a community consultation or the meeting of the CCM or of the PR, the attention span is much shorter. People less listening, less getting from what other people say, and it's more difficult to bring a human face. So if we have a face-to-face meeting and we have a community representative, sometimes the presence of people from the community have a huge impact on the other participant. Now we lost this opportunity. And we don't have an opportunity to for elevator pitch or coffee break chat with the stakeholder. So that's also work to our disadvantage. However, because of COVID, because of online, it's faster for us to organize consultation. It's easier to schedule a time than having to bring people coming from all over. It's less costly, and it's easier for some community member to participate, because the people who don't have an identification paper now don't have to worry about having to go from a very far place by plane to Hanoi, for example. It's because of the COVID time. So it's when we try to explain some of the issue that are faced by the community, people may want to when you say because of COVID, people may want to pay attention more than usual time. When you talk about, for example, the sex worker losing their income, people can understand and somehow more sympathize. Next slide, please. We learn a lot actually from this process. We realize that, as May already mentioned, that we need to communicate better. We need to communicate better with stakeholder and decision maker. But we see, because we work with the community every day, we know the impact of COVID. We know what happened, the service interruption, the people suffering. But we didn't do, at least us in Vietnam, we didn't do a very good job of communicating that with stakeholder. So we work with the community to deal with that, to cope with that, but we didn't communicate very well with other people outside the community. So I think it teach us that now when there's a crisis like COVID, we should do better job of monitoring, of collecting data, and of communicating, and in a timely manner with the people outside the community, so they know what is going on. They are engaged with us in dealing with that. We should never make assumption that other people must know. So we made the assumption that other people must know that how difficult it is for the community for COVID, but it's not true. And for the people already mentioned about the engagement that need to be early on, it needs to be frequent, it needs to be constructive. So that is I think over and over again we learned this lesson, but we are not always been able to do it. And it's when we propose something, when we bring the recommendation, we should make it easy for people to understand and propose straightforward and concrete solution. We shouldn't just like engage more with the community. And what does it mean? So it needs to be concrete. I think this also an opportunity to communicate wider, and I think it's good that we have connection with APCRG that have a way to the Global Fund Secretariats. We also communicate with the country team when we submit the recommendation to the CCM. So it is an opportunity to get people attention for the issue relating to COVID, not necessarily about the funding request. So when we organize the consultation, we mentioned in the report, in the narrative of the report, we mentioned the issue of treatment interruption and stock out of ARV. It wasn't because of the COVID, but it just happened during the time of COVID, and that got the attention of the country team and of other people. So so it is also an opportunity. Next slide, please. So we have a consultation with community representative from a very diverse background from all over the country, the north, the south, the central. We engage with the people in the consultation. We have the people who work on TB community and malaria community and HIV community. So from all different community and different issue, and then it is a really beautiful experience actually. We have people working with the homeless, the street children, to the ethnic minority, and it's an opportunity to bring people together and to get people to share the view and experience and learn from the other. And I think people already mentioned before that we need to interpret, we need to translate the C19RM into the language that easy for community to understand and relevant to our context. So after the community consultation, we send the report, a long report with 1 page of recommendation to the CCM in English and in Vietnamese, because we want to make sure that the technical partner and the development partner in the CCM also get what we propose, get our report, and not only in Vietnamese. So after we submitted that, the CCM asked for another meeting with us to discuss that, which was really, which we feel very encouraging. And I think what the Global Fund have done is to put in the template of the funding request about the community, the requirement in terms of community engagement, etc., is very helpful. Also, the CCM hub guidance for the CCM to engage with the communities also have to push a bit further the attention to the community. Next slide, please. So this is the first page of our report to the CCM. We have a long report with the detail of the consultation, but then we put 10 recommendations on 1 page with some summary. So if people don't want to read the long report, there's this 1 page that they can go through. Not all of our recommendations are taken up. And I have to say that between HIV, TB, and malaria, the HIV is doing fine. In terms of, okay, so there's a civil society PR. So civil society PR gets the C19RM portion that then share with SR. Wonderful. The best one in terms of engagement is TB. So the TB allocate funding for civil society to work on this. The one that we as a civil society consider as a failure is malaria. Malaria have nothing to do with the community despite our recommendation. And there's a question about the role of technical partner. We don't see any in terms of suggesting for CRG issue to be included in the malaria response to C19RM. Yeah, so I think I stop here, and thank you APCASO, thank you APCRG for being with us through this process. And I would like to again echo what May have said. Job is not done yet. We need to carefully guard the process. Gil already also mentioned it should not stop here. We should continue to follow, to guard the process, and then to make sure that community is a part of all the step between now and until during the implementation. So thank you.
Thanks, Wine. And I always find it very difficult to follow Wine just because you're so wise and insightful with what you share. And I always feel personally I learned so much just listening to your sharings. But really, again, thanks for you and your teams for supporting community engagement across the 3 diseases in Vietnam and for their engagement. And we'll definitely be capturing all these lessons learned and be coming back to you, especially for that next level of analysis in terms of what actually made it into the funding request against the community recommendation later on as well. But thank you so much again, Lan. I know that we are now at 4:15 Bangkok time, and that we wanted to call on one more speaker from Cambodia to share, but I'm not sure if Chenrum is online with us or not.
Yeah, I am. Jen.
Hi, Chenrum. Hi, everyone. If you could just just give us, if you could stay on for just a few more minutes, because we think the Cambodian experience is also really rich and really insightful as well. So if you could just stay on with us, and Chenrum, if you don't mind, just take a few minutes to share with us a little bit about the lessons from Cambodia, that would be much appreciated. And I know that you have another consultation happening at the same time, so on UHC as well. So yeah, thank you for being here. Over to you.
Thank you, Jen. Can I project my slide?
I will ask Jeff and Rata to let you know. Can we please allow share screen from Chenrum? Thank you.
Can you see my slide now?
Yes.
Okay. So once again, thanks a lot to be part of the discussion. I think especially thanks to listen to all the presentation from the friend and for their rich experience of how to engage in the C19RM process. But for Cambodia, I would say we may have a little bit different, because the way that we engage, when I say I am referring to community and civil society engage in the process of this C19RM, because it's not the way that we work here at the CCM delegate the technical discussion for this application to Ministry of Health, which is in our context. Ministry of Health is the leading implementing agency for a global fund, supported fund, for all the 3 diseases. So the way that they engage after we receive the envelope in mid-April, we start straightforward. The MOA mobilize the support from all stakeholders, including us. When I say us, it's not just civil society, but also affected community. And then the way that they discuss is discussed by, they have a central team, involve everyone, and then they divide according to the pillar within the COVID-19 response, because the way that they propose a C19RM application is using the structure of the COVID-19 master plan. So they divide the technical working group, and they assign the head of each technical working group based on the pillar within the COVID-19 response. So all of us involved in different technical working group based on assigned pillar, starting from the beginning of C19 proposal development till its summit. Especially for Kana, as part of the member of CCM, and we are representing the civil society and our partner, we represent in pillar 2, pillar 3, pillar 6, pillar 7, pillar 9, and pillar 10. Pillar 2 is more on community engagement. They call risk communication and community engagement. Pillar 3 more around the IPC, infection prevention and control. Pillar 6 more about the Pillar 6, Pillar 7 more about the material equipment. Pillar 9 disease specific for the 3 diseases, and Pillar 10 is more about the vaccine, C19 COVID-19 vaccine support component to ensure the specific issue need of community and civil society in 3 diseases are integrated into C19 application. Community and civil society, we had opportunity to propose and integrate the key intervention in addressing the real need of affected community under Pillar 2 and Pillar 9 of the 3 diseases. And for us from Kana and our partner, we proposed the key CIG intervention in to be owned and led by community, while Pillar 6 and 7 are also focused on PPE, support to community and civil society. Before the C19 country dialogue, there are more than 10 meetings actually. Like I said, we start in the mid of April, and very similar case to what On mentioned. We are in the peak of COVID-19 community transmission as well. Actually, in April is a Cambodian New Year, Sangkran, Sangkran in most of the country in the region. So we, under the lockdown, we are not allowed to do any travel, but so it's also challenging actually, challenging to go to have kind of this meeting and discuss widely, but we still can run the meeting virtually, even though during that time that we're supposed to have our holiday, but we cannot. We have to engage because Kana is the leading civil society. We have to mobilize our affected community to be part, even though somehow, it's a little bit hard for them because of the access to technology, phone, computer, and internet. It's not easy, but they still try their best with support from the CCM Secretariat and with the resource support by CIG through APCASO. We've been able to engage, can get them to engage in the process. So our representative of community and civil society, we engage in consultation meeting where, in addition to participate in the technical working group, we also retreat, we discuss, and we agree among each other, what we should, push, what we should advocate into the list, and then each member who participate in the discussion then go back to technical working group and present and share. So it's more integrated approach. For example, HIV under the leadership of the National HIV Program for TB, under the lead of National TB Program, and malaria under the lead of National TB the malaria program. But in addition to that, we also engage with CDC. Where they look at the aspect of IPC, they look at the aspect of the PPE, they look at the aspect of how, where the National Center for Health Promotion, they're looking at the risk communication and community engagement. So we try to ensure how can the key asks that we agree with in the consultation within civil society be integrated into each pillar under each leadership of the technical working group.
Shimram, may I interrupt you a little bit? And I'm really my apology just because I know that we're taking up a lot of your time and we are also going over time.
Yeah.
And that if possible, can we will share the rest of your slides, but
Yep.
I just want to have a quick question because I think we had earlier also asked you, you know, based on your experience and that what do you think that how do you think Global Fund could do better for the next round? And if you could just, if you don't mind, I think if you could answer that in the next minute or two, that would be really great. Yeah.
I think actually in this slide is covered, but because of time, I just want to say that, you know, timing is really issue because you know, we working during the peak of the pandemic, but also in the holiday time, and the issue of the access to technology is also a certain thing. So if I would suggest to the Global Fund, you know, I know that this is emergency funding support, so it somehow it requires the emergency action, you know, to get engaged. But very important is to ensure how we can be well informed. But thank a lot to all the material that is supplied because they are very useful, and the support from CIG department, SI department through APCASO, we've been able to look in advance, to review, to translate, and then we supply. I think that support is very critical. But I think this kind of thing should continue. Should be provided, and the Global Fund should not just looking at the one-off, but looking at, I think other colleagues also mentioned, it should be part of ongoing, maybe Mangala mentioned in her slide, it should be an ongoing support. So then the community and civil society are well informed, be ready, and actively engaged. That is very critical because in this kind of emergency, we don't know whether we are living with this emergency for how many more years, you know, or whether there will be another emergency. But the ongoing aspect of CIG support, that is really critical, especially the investment on institutional capacity of engagement. That is very critical. So then we are ready. We do have a capacity, we do have the resource, and we well prepared. So that is my message. That is my message. In addition to timing, that I see that a challenge, but I know that this kind of the emergency. So we have to adopt ourselves into that situation, but the support should be ready so then the material can be translated on time, the people are informed, the engagement are ready, are prepared, for example. Thank you.
Great, thank you so much, Shimram. And I think you really helped put further emphasis on a number of points, both in terms of challenges and in terms of what's needed going forward as well. And I think many of the speakers, including yourself, you know, talks about, you know, the resources that be needed for supporting engagement, but also, you know, this point earlier about that our work is not done just because the funding request has been submitted, that we need to continue to engage and you know, when the fund comes down, you know, in terms of implementation, but monitoring and really holding stakeholders, the PR, the government, but also ourselves accountable for the funding that we have received for the interventions that would be very much needed at the ground. But again, I thank you so very much, Shimram, for sharing the Cambodian experience.
Just one more, because you talk about data, and I think On also mentioned that in my slide, I also say that, you know, because if we don't prepare in advance, we may not have this kind of information to fit on time with the call for application, you know, because Cambodia decided to submit a funding request for the fast track, you know, by the end of April, where we implement Khmer New Year, but also in the peak of COVID-19. So very short sample, but data is very critical, and we well prepared. So I think that's why the ongoing support from the CIG department, the donor on this kind of thing, having community own the process, be ready, be informed. I think that is really critical. I will share the slide and then you can share with other people, because, but importantly, you know, in this emergency funding request application, I would say that there is a lot of learning actually, especially how to better looking at not just specific disease, but in somehow it linked to system support. Because we integrate into COVID-19, you know, so I think it's more about the system support. So the community be part of that process, and some of department we don't know each other before, but through that process we connect. So I think that thanks a lot to all the resources that allow community to be mobilized and be engaged. Thank you.
Absolutely, and I think it's going back to what Wayne was saying, that, you know, like, I mean, it's quite devastating to see the impact of COVID on our community, but it has also, to us, on the other hand, been a beautiful experience, quoting Juan, in terms of an opportunity for us to reach out and to open doors for us to work with other communities and other stakeholders that we have yet to have the opportunity to do so. So thank you for those really wonderful kind of sharing, Shamroom. And again, apologies, and thank you so much again to the rest of the group who have managed to stay on with us. We continue to be very horrible at managing our time with our webinar, and I think it's one of the challenges of doing things virtually, but we really do appreciate everyone sharing and staying with us. So before we close, we have our traditional request from Jeff. I'm just putting it to Jeff to have everybody, if possible, to turn on your video so then we can do our kind of COVID-19 pandemic type of group photo, given that we don't have opportunity to be together yet. But again, yeah, while everybody's getting ready, and I can see some people are in the car now, we've taken up so much of your time, or some people are outside. It's toward the end of the day. Thank you. Turn on your video, and then I will turn the floor over to Jeff for instructing us to take a photo. But thanks again, everyone. And we will be sharing the presentation, the recording, and also the report later on with everybody. Again, yeah. Thanks. Over to you, Jeff.
Thank you, Jen. Just to also flag that we will develop an advocacy brief in relation to this webinar, which will be the last piece of material that we will be developing under the C19RM. So please watch out for that. And with that, I'm with Myra, our intern for this year, who will take us with the photos. So Myra, once you're ready. Yeah.
Okay. A young person, she's more refined with the technology, right, Jeff?
Stop rubbing it on me, Jen. I'm so young. Anyway, all right, 1, 2, 3, smile. One more, 1, 2, say vaccine.
Vaccine.
Okay, one last 1, 2. All right. I think we're good. Thank you so much for joining, everybody.
Keep safe, everyone, and thank you so much again. Stay tuned to our Facebook posting for related information, and then the next step as well. And thanks again to colleagues from outside of our region, including Olive. A big shout out to Olive. It's so lovely seeing you for joining us. All right.
Thank you, Olive. Bye-bye.
Take care. Bye-bye.
Bye.
Done.